Hello, good day everyone. I am Arian Yvonne Fajardo and I am the second reporter for behavioral therapy. And now I will be discussing to you the application, therapeutic techniques, and procedures. So, for our topic outline, under sa therapeutic techniques and procedures, we have applied behavioral analysis, operant conditioning techniques, progressive muscle relaxation, systematic desensitization, in vivo exposure and flooding, eye movement desensitization and reprocessing, social skills training, self-management programs and self-directed behavior, and lastly, the multimodal therapy. So, a hallmark of the behavioral approaches is that the therapeutic techniques are empirically supported and evidence-based practice is highly valued. Meaning, ang mga therapists ay guided sa kanilang approach with clients by first, the current and relevant research on effective treatment for a particular problem or disorder. And the second one is the research and clinical expertise on what works for a particular client and how a treatment may need to be adjusted in the context of the client's unique characteristics, needs, and preferences. That is why, according to Arnold Lazarus, who is best known for developing multimodal therapy, sabi niya, behavioral practitioners can incorporate into their treatment plans any technique that can be demonstrated to effectively change a behavior. So, ina-advocate niya yung use of diverse techniques regardless of their theoretical origin. Yung mga procedures na ginagawa ng mga behavior therapists are specifically designed for a particular client. Hindi lang yan nila basta-basta gina-randomly select. Kaya oftentimes, they are quite creative in their interventions. So, ayun nga, very clear din ang behavior therapists do not have to restrict themselves only to methods derived from learning theory. Ang mga behavioral techniques can be incorporated into other approaches na which will be illustrated later on. So, itong iilan ng mga techniques na i-discuss ko is hindi nila ganun ka nai-encompass yung full spectrum of behavioral procedures, but they do represent a sample of the approaches used in the practice of contemporary behavior therapy. So, first, dito tayo sa applied behavioral analysis, the operant conditioning techniques. So, ito lang yung tandaan nyo pagdating sa operant conditioning techniques kasi may few key principles yan. Positive and negative reinforcement and punishment and extinction. So, pag ang target is to increase the behavior, kailangan mag-use ka ng reinforcement method. Pag to decrease naman yung behavior, gagamit ka ng punishment. So, magbigay ako ng example. Sa positive reinforcement, ito yung pag-pair ng positive stimulus to a behavior. A good example of this is when teachers reward their students for getting a good grade with stickers. So, yung reward ng teacher na stickers, yun yung nagsisilbing reinforcer para mag-strive yung children na makakuha ng mataas na grade. So, sa negative reinforcement naman is yung pag-remove ng unpleasant stimulus to increase the behavior. A child that throws a tantrum because he or she doesn't want to eat vegetables and has his or her vegetables taken away would be a good example. So, para hindi magmao yung bata, parang hindi maging ganun yung behavior niya, kinukuha yung ayaw niyang kainin, which is yung gulay na nag-serve as the unpleasant stimulus. Sa punishment naman, it is designed to weaken the behaviors by adding an unpleasant stimulus or by removing pleasant stimulus. So, sa positive punishment, mag-a-add ka, diba, ng unpleasant stimulus. So, example niyan is pag ang bata sumasagot-sagot sa parents niya. So, ang gagawin ng kunwari mama niya is mag-a-add siya ng unpleasant or aversive stimulus, which is yung pagpalo niya sa kanyang anak para malaman ng bata na hindi maganda yung ginagawa niya. And by that, mas magbaba yung possibility na gawin niya ulit yung behavior, yung pagsagot-sagot sa parents niya, kasi alam niya yung consequence na kapag uulitin niya yun, papaluin siya. Sa negative punishment naman, for example, yung anak mo is pabaya sa pag-aaral kaya mababa yung nakukuha niyang grade. And sa tingin mo, dahil yun sa kaka-cellphone niya, so since negative punishment siya, i-confiscate mo yung phone niya. Yun yung pleasant stimulus na i-remove mo para ma-decrease yung behavior niya sa pagiging pabaya sa kanyang academics, no? And mag-strive to do better. So, sa extinction naman, it occurs when reinforcement of a previously reinforced behavior is discontinued. So, example, ako yung, kunwari bata ako, gusto ko makuha yung attention ng nanay ko by dropping my toys on the floor kasi ang usually lang na ginagawa niya, pag ginagawa ko yun, is parang hayaan niya lang, mag-smile lang siya sa akin, tapos pulutin niya ulit yung toys, ibalik sa akin. Tapos parang ako, ang maisip ko, i-drop ko na lang always yung mga laruan ko para always niya ako mapansin. So, to address this problem, no, yung nanay ko dapat, ang gawin niya is to ignore me. Kasi, if she constantly do that, yung pag-tolerate ng behavior ko, mas magkakaroon ng chance na di mako-correct or maaayos yung behavior ko na yun. So, this is a powerful tool and works well with, especially with young children with autism and Down syndrome. So, next we have the progressive muscle relaxation. So, this has become increasingly popular now as a method of teaching people to cope with the stress produced by daily living. So, dito na procedure ang kailangan is muscle and relaxation. So, tuturuan ng therapist ang client about sa basic na relaxation procedures. And dapat pinapractice to ng client itong mga exercises daily to obtain maximum benefits or maximum results. So, kung makikita nyo dyan sa picture, yung mga pwedeng gawin, kailangan may muscle contraction. Meaning, i-stretch mo muna or i-tighten mo or lagyan mo ng tension yung sa specific part ng katawan mo. And then, this will be followed by muscle relaxation kasi i-release mo yun. I-return mo into normal state and doon mo mafe-feel yung pagka-relax sa muscle and also magiging mentally relaxed ka din. So, through deep and regular breathing din to, no? Kasi makaka-focus ka sa mga positive and pleasant thoughts. Siyempre, itong procedure din na ito, kailangan nasa quiet environment ka. Relaxation becomes a well-learned response which can be habitual pattern if practiced daily for about 25 minutes each day. So, dito na procedure, it has since been refined and modified and are frequently used na in combination with a number of other behavioral techniques. These include systematic desensitization, assertion training, self-management programs, audio tape recordings of guided relaxation procedures, computer simulation programs, biofeedback-induced relaxation, hypnosis, mediation, and autogenic training. So, the most common use of this relaxation procedures has been with problems related to stress and anxiety, which are often manifested in psychosomatic symptoms. Our relaxation training has benefits in areas such as preparing patients for surgery, teaching clients how to cope with chronic pain, and reducing the frequency of migraine attacks. Some other ailments for which progressive muscle relaxation is helpful include asthma, headache, hypertension, insomnia, irritable bowel syndrome, and panic disorder. Next is the systematic desensitization. This is based on the principle of classical conditioning and is a basic behavioral procedure developed by Joseph Wolf, one of the pioneers of behavior therapy. So, itong procedure na ito, it can be considered as a form of exposure therapy kasi required ang clients na ma-expose sa anxiety-arousing images as a way to reduce anxiety. But gradually siya, meaning slowly and pakonti-kunti hanggang sa ma-achieve yung main goal, diba? To eliminate the fear or the anxiety sa patient. Maging relax sila. So, ito ay may 3-step process. Pero take note, before mo i-implement itong procedure na ito as a therapist, need mo mag-conduct ng initial interview para ma-identify yung specific o yung detailed information about the anxiety and also to gather relevant background information about the client. Yung interview na yun, pwede yun makatake ng several sessions para mas magkaroon ng deeper understanding ang therapist about sa client. Tinatanong dyan madalas, for instance, under what circumstances does the client feel anxious? Or if the client is anxious in social situations, does the anxiety vary with the member of people present? Or is the client more anxious with women or men? So, mga ganyan na tanong. Kaya, the client is asked to begin a self-monitoring process consisting of observing and recording situations during the week that elicit anxiety responses. Ang ibang therapist pa nga is mag-a-administer pa yan sila ng questionnaire para makagather ng additional data about sa situations na nagalid ng anxiety ng kanilang client. So, yun na nga, sa 3-step process. First is the relaxation training. So, I guess alam niyo naman kasi na-discuss ko na yan siya recently. Bago lang, ngayon lang. So, next, by the way, sa step 1 na process, mag-matter din to sa therapist, no? Kung paano niya i-handle ang first step. Kailangan ang therapist gina-use niya yung quiet, soft, and pleasant voice to teach progressive muscular relaxation. So, the client is asked to create imagery of previously relaxing situations, such as sitting by a lake or wandering through a beautiful field. It is important that the client reach a state of calm and peacefulness bago siya i-expose sa next step, which is the development of a graduated anxiety hierarchy. Ito yung list of situations relating sa target behavior to which a client will interact with varying degrees of anxiety. So, kung makikita nyo dyan sa table, diba, yan yung anxiety hierarchy na kung saan magsa-start yung exposure sa list pa lang, no, na situation na pwedeng makaramdam ang client ng fear and anxiety hanggang sa maka-adjust siya and hanggang sa mag-level up yung exposure and eventually ma-overcome niya yung kinakatakutan niya by exposing the client directly sa pinaka-anxiety evoking situation para sa kanya. And lastly, yun na nga, systematic desensitization proper that involves the presentation of hierarchy items while the client is in a deeply relaxed state. So, not only does systematic desensitization have a good track record in dealing with fears, it also has been used to treat a variety of conditions including anger, asthmatic attacks, insomnia, motion sickness, nightmares, and sleepwalking. So, next na procedure, we have the in vivo exposure and flooding. Okay, so generally, ang exposure therapies ay designed siya to treat fears and other negative emotional responses by introducing clients under carefully controlled conditions to the situations that contributed to such problems. So, isa sa mga specific procedure ng exposure therapy ay ang in vivo exposure. In vivo is a Latin word or phrase na ang meaning is within the living. So, in therapy, ito yung pag-expose sa client to the actual anxiety-evoking events rather than simply imagining these situations. So, live exposure has been a cornerstone of behavior therapy for decades. So, sa treatment na ito, for example, someone with a fear of snakes might be instructed to touch or to hold a snake. Or someone with a social anxiety might be instructed to give a speech in front of an audience. So, typically, ang treatment na ito ay nag-uumpisa yan siya with a functional analysis ng objects or situations na ina-avoid or kinakatakutan ng client. So, together, the therapist and the client generate a hierarchy of situations for the client to encounter in ascending order of difficulty. So, ayun na nga, same lang siya sa systematic desensitization na clients learn responses incompatible with anxiety, such as responses involving muscle relaxation. Clients are encouraged eventually to experience their full fear response during exposure without engaging in avoidance. So, between therapy sessions, clients carry out self-directed exposure exercises. So, eventually, dapat nakakayanan na nilang i-control ang situation sa kanila lang. Then, ang kanilang home practice progress ay nire-review yan, and ang therapist naman is mag-provide ng feedback on how the client could deal with any difficulties encountered. So, sa flooding naman, this is another form of exposure therapy that refers to either in vivo, meaning live or actual, or imaginal exposure to anxiety-evoking stimuli for a prolonged period of time. So, kindly take note of that. So, ito siya ay intensive type of exposure therapy in which you must face your fear at a maximum level of intensity for an extended amount of time. So, there's no avoiding the situation and no attempt on the therapist's part to reduce your anxiety or fear. So, kung ikaw may claustrophobia ka, yung extreme fear sa mga enclosed spaces, ang pwedeng gawin sa'yo as a client is magkakaroon ka ng flooding session that might involve sitting in an extremely small, crowded room for several hours. So, matagal siya. This might even involve an elevator or a closet. A proper flooding session would require that you stay in the room until your panic response has fully subsided. So, itong flooding na ito, may dalawa din siyang klase, ang in vivo flooding and imaginal flooding. So, in vivo flooding, it consists of intense and prolonged exposure to the actual anxiety-producing stimuli. Kagaya nung in-example ko, bago lang, yung mga taong may claustrophobia, ini-expose sila sa mga masisikip or crowded na place in actual. However, in vivo exposure to actual traumatic events, kagaya ng airplane crash, rape, fire, flood, diba? Hindi man sila pwedeng i-expose ulit doon. So, it is often not possible nor is it appropriate for both ethical and practical reasons. Kaya meron tayong isang type pa ng flooding which is ang imaginal flooding. From the word imaginal, meaning yung exposure occurs in the client's imagination instead of in daily life. Imaginal flooding can recreate the circumstances of the trauma in a way that does not bring about adverse consequences to the client. So, kunwari nga yung survivors of an airplane crash, for example, may suffer from a range of debilitating symptoms or yung pagkakos na serious impairment of strength or ability to function. So, they are likely to have nightmares and flashbacks to the disaster. They may avoid travel by air or have anxiety about travel by any means. And they probably have a variety of distressing symptoms such as guilt, anxiety, and depression. So, vividly imagining the feared object, situation, or activity. So, ang ginagawa ng therapist dito, for example, someone with post-traumatic stress disorder might be asked to recall and describe his or her traumatic experience in order to reduce feelings of fear. So, ganun ang imaginal flooding. In vivo and imaginal exposure as well as flooding are frequently used in the behavioral treatment for anxiety-related or disorders, specific phobia, social phobia, panic disorder, obsessive-compulsive disorder, post-traumatic stress disorder, and agoraphobia. Next is the eye movement desensitization and reprocessing, or the EMDR. This was developed by Francine Shapiro, 2001. So, it is a form of exposure therapy that entails the three basic processes. First is the assessment and preparation. Second, imaginal flooding. And last, cognitive restructuring in the treatment of individuals with traumatic memories. So, the treatment involves the use of rapid, rhythmic eye movements and other bilateral stimulation to treat clients who have experienced traumatic stress. So, basically, yung makikita nyo dyan na peak, kanyan piniperform ang EMDR, which is comprehensively identifies and addresses experience that have overwhelmed the brain's natural resilience or coping capacity and have thereby generated traumatic symptoms and or harmful coping strategies. Through this procedure, people are able to reprocess traumatic information until it is no longer painful or causing disruption in their lives. So, ganun lang ang EMDR. Next is the social skills training. So, it is a broad category that deals with an individual's ability to interact effectively with others in various social situations. So, typically, social skills training involves various behavioral techniques kagaya ng psychoeducation, modeling, behavior rehearsal, and feedback para magamot yung psychosocial problems ng isang client by increasing his or her interpersonal skills. Sigrin 2008 identified these key elements of social skills training, which entail a collection of techniques: assessment, direct instruction and coaching, modeling, role-playing, and homework assignments. So, yan yung mga pwedeng gawin to help clients develop and achieve skills in interpersonal competence. A few examples of evidence-based applications of social skills training include alcohol or substance abuse, attention deficit hyperactivity disorder, bullying, social anxiety, emotional and behavioral problems in children, behavioral treatment for couples, and depression. So, a popular variation of social skills training is the anger management training and the assertion training. Anger management training is for those people who have trouble with aggressive behavior. Now, ang assertion training naman is for people who lack assertive skills. Ito ay specialized form of social skills training, consists of teaching people how to be assertive in variety of social situations. So in this light, assertiveness is about yung pagiging open and honest mo about your feelings and values and wishes. So yung pagiging assertive, very important yan siya for your mental well-being. When you're able to express yourself honestly and openly, you can be true to yourself and honor what you need to thrive. Kaya assertion training can be useful for those, one, who have difficulty expressing anger or irritation, two, who have difficulty saying no, three, who are overly polite and allow others to take advantage of them, four, who find it difficult to express affection and other positive responses, five, who feel they do not have a right to express their thoughts, beliefs, and feelings, or six, who have social phobias. It is often conducted in groups kasi when a group format is used, the modeling and instructions are presented to the entire group and members rehearse behavioral skills in role-playing situations. After the rehearsal, the member is given feedback that consists of reinforcing the correct aspects of the behavior and instructions on how to improve the behavior. Each member engages in further rehearsals of assertive behaviors until the skills are performed adequately in a variety of simulated situations. Okay, next is the self-management programs and self-directed behavior. So this involves psychologists being willing to share their knowledge so that their clients can increasingly lead self-directed lives and not be dependent on experts to deal with their problems. So, understandable naman siya no, na title pa lang na dito ang mga psychologists, sila yung nag-share ng knowledge nila para ma-manage ng clients nila yung sarili nila or yung sariling buhay nila effectively. So, self-management strategies include self-monitoring, self-reward, self-contracting, and stimulus control. So the basic idea of self-management assessments and interventions is that change can be brought about by teaching people to use coping skills in problematic situations. Generalization and maintenance of the outcomes are enhanced by encouraging clients to accept the responsibility for carrying out these strategies in daily life. So sa mga self-management programs, people make decisions concerning specific behaviors na gusto nilang i-change or i-control. So, for people to succeed in such a program, careful analysis of the context of the behavior pattern is essential. And people must be willing to follow some basic steps such as those provided by Watson and Tharp 2007. So, sa steps na ito, merong, ilan ba to? Five steps. Ang first is selecting goals. So, ang goals should be established one at a time. And they should be measurable, attainable, positive, and significant for you. It is essential that expectations are be realistic. Kaya, syempre, kung mag-set ka ng unrealistic goals para sa sarili mo, pag di mo na-achieve yun, magkakaroon yan ng major impact sa motivation mo, ma-frustrate ka, and it could also affect your self-esteem and your productivity also. So, next is translating goals into target behaviors. So, identify behaviors targeted for change. Once targets for change are selected, anticipate obstacles and think of ways to negotiate them. Third, self-monitoring. Deliberately and systematically observe your own behavior and keep a behavioral diary, recording the behavior along with comments about the relevant antecedent cues and consequences. Fourth, working out a plan for change. Devise an action program to bring about actual change. Various plans for the same goal can be designed, each of which can be effective. Some type of self-reinforcement system is necessary in this plan because reinforcement is the cornerstone of modern behavior therapy. Self-reinforcement is a temporary strategy to use until the new behaviors have been implemented in everyday life. Take steps to ensure that the gains made will be maintained. And finally, the fifth one, evaluating an action plan. So, evaluate the plan for a change to determine whether goals are being achieved and revise the plan as other ways to meet goals are learned. Evaluation is an ongoing process rather than a one-time occurrence, and self-change is a lifelong practice. So, for the last procedure, the multimodal therapy or clinical behavior therapy. It is a comprehensive, systematic, holistic approach to behavior therapy developed by Arnold Lazarus. So, ito yung sinabi ko a while ago na ang mga behavior therapists, hindi nila nire-restrict sa isang technique or procedure lang yung kanilang intervention to effectively change a behavior. From the word multimodal, this is an open system that encourages technical eclecticism, in that it applies diverse behavioral techniques to a wide range of problems. So, multimodal therapists borrow techniques from many other therapy systems. May mga bagong techniques that are constantly being introduced and existing techniques refined, pero di basta-basta ang pag-a-apply nito sa client. Yung mga multimodal therapists, they are trying very hard to determine precisely what relationship and anong treatment strategies ang mag-work best with each client and under which particular circumstances. So, therapeutic flexibility and versatility along with breadth over depth are highly valued. And multimodal therapists are constantly adjusting their procedures to achieve the client's goal. So the therapists need to decide when and how to be challenging or supportive and how to adapt their relationship style to the needs of the client. Multimodal therapists also tend to be very active during therapy sessions, functioning as trainers, educators, consultants, coaches, and role models. So they provide information, instruction, and feedback as well as modeling assertive behaviors. They offer suggestions, positive reinforcement, and are appropriately self-disclosing. Ngayon, ang multimodal therapy ay nagsastart yan siya sa isang comprehensive assessment of the 7 modalities of human functioning and the interaction among them. A complete assessment and treatment program must account for each modality of the basic ID. Ano yung basic ID na yan? May meaning yan siya, which is the cognitive map linking each aspect of personality. So, the basic ID assessment process, 7 major areas of functioning. B is for behavior, A for affective responses, S for 5 sensations, I for images, C for cognitions, I for interpersonal relationships, and D for drugs or biological functions, nutrition, and exercise. So, kung makikita nyo dyan sa table na yan, meron dyan yung 7 major areas of functioning and yung behaviors na nakafocus sa mga area na to, and yung questions din to us sa assessment process. So, after nyan dyan, mag-plan na carefully anong mga techniques ang pwede nilang i-incorporate para sa therapy ng kanilang clients. Okay, so meron pang natirang 2 therapeutic techniques and procedures ang naiwan. And that will be discussed by the next reporter. So that would be all for my report. Thank you for listening and have a good day, everyone.